The more contagious variant of COVID-19 first identified in the UK is responsible for that explosive outbreak in Barrie. And new tonight, a scathing inspection report from the province found disturbing violations at the home just days after the outbreak was declared. Violations similar, if not identical, to what we've seen at other long-term care homes that have endured massive outbreaks.
We saw it at Tender Care. We saw it at Sunnycrest. We saw it at St. George. Now we're seeing it at Roberta Place. Why is this happening over and over again?
Inside Roberta Place long-term care home, all but 2 residents have been infected and 40 people have died since an outbreak was declared January 8th. A provincial inspection conducted just 4 days later found the operator failed to ensure that the home was a safe and secure environment for its residents. The inspector identified rooms that were shared by both confirmed positive residents and residents not confirmed to have COVID-19. Certain staff were providing care to both confirmed positive residents and residents not confirmed to have COVID-19. And all residents in the home were required to be in their room isolating under droplet and contact precautions at all times. Multiple residents were observed out of isolation, touching high-touch surfaces and coming in close contact with other residents.
These are massive and deadly faux pas that we are very aware of. And yet time and time again, we're seeing these mistakes repeated at a variety of often for-profit homes with zero accountability and zero consequences.
The consequences of this report, the inspector issued a compliance order to ensure proper cohorting and isolation of residents at the home.
We do not actually revoke licenses. We don't properly institute heavy financial penalties. We are not doing anything. We provide written warnings, which is essentially a nice little tap on the wrist.
In fact, in the past 3 years, this home has already been hit with 12 previous compliance orders, 30 voluntary plans of correction, and 15 written notifications. The contagious strain, a growing concern for Simcoe Muskoka District Health Unit. Investigators now trying to confirm whether the UK variant is behind the outbreak at a second home in the region. 6 residents and 3 staff have been infected at Bradford Valley Care Community.
We need the laboratory confirmation to determine that, but that is our concern at this time.
The Ford government says to help with those efforts, the province is ramping up testing for the variant to 1,500 a week starting next week. A total 9,000 samples have been tested for it so far.
We're much on top of it, and we are detecting it very quickly so that we'll know how to deal with different geographic areas where it may show up.
We did reach out to Jarlette Health Services, which operates Roberta Place, about the violations at the home. We haven't heard it back yet.